She knows she needs another medical opinion. But she doesn't know where to start. Which hospital? Which department? Which doctor? Will her records make sense to a doctor in China? And once she arrives, who will help her find her way? This is where our work begins. For months, pain in her knee has followed her through ordinary days, walking, climbing stairs, getting up from a chair. She has already seen a doctor at home. She has had an X-ray and an MRI, and she has heard one opinion. But she still wants to understand her situation more clearly. So she began to look further. She found that China has large hospitals and experienced teams. In Changsha, there is the Xiangya medical system. But knowing a system exists is not the same as knowing how to use it. Which hospital? Which department? Which doctor? Will her MRI and X-ray be useful there? How does she book an appointment? For someone who has never been to China, these questions are harder than they look. We are not a hospital. We are not a medical institution. We do not diagnose, and we do not decide treatment. We coordinate, connecting a patient's information with China's hospitals, and with the practical steps in between. That is where our work begins. Sarah reached us through our website. She told us the pain had lasted months, that she had seen a local doctor, and had been through examinations and treatment. We did not tell her where to go. First, we needed to understand. When did the pain start? Was there an injury? What tests had she done? What medication, what treatment? And what did she most want to resolve by coming to China? Then she sent us her records, an MRI report, an X-ray, blood tests, a note from her doctor, even records from years ago. A lot of material, but not one clean file. So we helped her bring it together, her history in order, her results, her past diagnosis and treatment. One thing should be clear: organizing records is not a diagnosis. Those decisions belong to doctors. With the records organized, the next question was, where should Sarah begin? A city may have many hospitals, many departments, many specialties. What is her main problem? Which specialty does it need? Are her past tests useful here? These questions form the logic of how we match. In Changsha, the Xiangya system, Xiangya Hospital, the second Xiangya Hospital, the third Xiangya Hospital is one of the resources we understand. But we would not tell every patient, come to Xiangya, simply because of the name. For Sarah, the question was more specific: which hospital and which specialty fit her situation. What she needed was not the name of the best hospital, but an answer that was actually about her. For a local patient, booking is familiar. For someone from abroad, it is different. Which entrance? Which department to register? How does the visit actually work? So once the direction was clear, we helped Sarah with the appointment and with preparing her visit. Now the non-medical questions began. When should she arrive in Changsha? Where would she stay? How would she get from the airport? Would the consultation and tests happen the same day? If the doctor asked her to return, how long would she stay? These are not medical decisions, but for a first-time visitor, they shape the whole experience. So we planned them together. A few days later, Sarah landed in Changsha. Her first time in China. A new language, new transport, a hospital system she had never entered. Our job was to make each unfamiliar step easier to understand, from the airport to the hotel, from the hotel to the hospital, from the entrance to the right department. Small steps, but in a foreign country each one can become a problem. On the day of her visit, we walked her through it. Registration, waiting, the doctor's office. If more tests were needed, where to go and when. We provide this support on the ground when a patient needs it. But our boundary stays clear. We do not tell the doctor how to treat. We do not make medical decisions for the patient. We do not interpret a result as a diagnosis. The doctor is responsible for the medicine. The patient is responsible for her own choice. We are responsible for coordinating the process between them. Inside the consultation room, the real medical work began. The doctor reviewed her history, looked at her records, and made a professional assessment. If more tests were needed, the hospital would arrange them through its normal process. Our role stayed the same: coordination. Where are the tests done? When? Do they need booking in advance? When does she return for the results? These are the things we continued to handle. But whether to have a test, what treatment to accept, whether to proceed with surgery, whether to watch and wait, these were hers to decide, once she understood the doctor's advice. If the doctor recommended further treatment, Sarah would have more questions. How long would it take? Would she need to stay in hospital? How much longer in Changsha? Would she need to come back? For these, we continued to coordinate. Even after Sarah goes home, the journey does not always end. Some patients need a follow-up, some keep watching, some keep in touch with the doctor. With her permission, we can keep passing information and keep coordinating. This is why we do not see our work as a one-time introduction to a hospital. It is a whole process, from the first message, through records, direction, matching, booking, arrival, the visit, and everything after. We work to make each step standard and clear: where she is now, what comes next, why, and what it costs. Medical decisions belong to doctors. Choices belong to patients. We coordinate the journey in between. In the end, Sarah finished her visit to China. She may have received a new medical opinion. She may have completed further tests. She may have begun treatment. Whatever the outcome, we never promise it in advance. We cannot promise that coming to China will cure anything, or that one doctor is the best. That is not our role. Our role is to provide information, coordinate resources, and organize the process. For some patients, China is a real option. For others, it may not be, and we should say so honestly. Because trust is the foundation of this work. When Sarah first wrote to us, she had only questions. By the end, she knew where to begin, where to go, and what came next. She did not have to face an unfamiliar medical system alone. Medical decisions belong to doctors. Choices belong to patients. We coordinate the journey in between. Your medical journey in China, coordinated.